Welcome to this video on respiratory distress syndrome, or RDS. We will be mastering neonatal respiratory care and management. Let's start with our first question. What is the primary cause of respiratory distress syndrome, RDS, in neonates? Is it pulmonary hypoplasia, deficiency of surfactant, excess of lung fluid, or congenital heart disease? The correct answer is B. RDS is caused by a deficiency of pulmonary surfactant, leading to increased alveolar surface tension, atelectasis, and respiratory failure. Next question. What is the classic radiographic finding in neonatal RDS? Is it hyperinflated lungs, ground glass opacity, patchy consolidations, or pleural effusion? The correct answer is B. RDS presents with a fine reticulogranular pattern, often described as ground glass appearance, along with air bronchograms due to collapsed alveoli. Which of these is a clinical sign of respiratory distress? A. Nasal flaring, B. Grunting, C. Intercostal retractions, or D. All of the above? The correct answer is D. Signs of increased work of breathing in neonates include nasal flaring, grunting, intercostal/subcostal retractions, and tachypnea. Moving on. Which hormone promotes surfactant production? Is it insulin, glucocorticoids, growth hormone, or thyroid hormone? The correct answer is B. Glucocorticoids, like betamethasone, accelerate the maturation of fetal lungs and stimulate surfactant production when administered antenatally. Why is an infant of a diabetic mother, IDM, at higher risk for RDS? A. Insulin inhibits surfactant synthesis. B. Glucose stimulates surfactant synthesis. C. High blood flow. Or D. None of the above. The correct answer is A. Hyperinsulinemia in the fetus of a diabetic mother antagonizes the effects of cortisol, delaying the production and maturation of surfactant. What is the primary function of surfactant? A. Increase lung fluid. B. Reduce alveolar surface tension. C. Increase airway resistance. Or D. Prevent mucus secretion. The correct answer is B. Surfactant reduces surface tension at the air-liquid interface within the alveoli, preventing collapse atelectasis during expiration. Which scoring system assesses the severity of respiratory distress in neonates? A. APGAR score. B. Silverman-Anderson score. C. Glasgow Coma Scale. Or D. Bishop score. The correct answer is B. The Silverman-Anderson scoring system assesses respiratory distress in neonates using chest retraction, grunting, and nasal flaring. Lower scores indicate better breathing. What is the preferred route for exogenous surfactant administration? A. Intramuscular, B. Intravenous, C. Intratracheal, or D. Oral. The correct answer is C. Exogenous surfactant must be administered directly into the lungs through an endotracheal tube, which is the intratracheal route, to be effective. Oxygen therapy in preterm infants carries the risk of A. Retinopathy of prematurity, ROP, B. Rickets, C. Scurvy, or D. Anemia. The correct answer is A. Hyperoxia, or excessive oxygen, damages developing blood vessels in the retina, leading to retinopathy of prematurity, a major cause of preventable childhood blindness. CPAP helps in RDS management by A. Increasing lung volume by PEEP, B. Providing 100% oxygen, C. Eliminating CO2 entirely, or D. Sedating the infant. The correct answer is A. Continuous positive airway pressure, or CPAP, provides positive and expiratory pressure, preventing alveolar collapse and maintaining functional residual capacity. Which surfactant protein is essential for surface tension reduction? A. SPA, B. SPB, C. SPC, or D. All of the above. The correct answer is D. Surfactant proteins sulfur monophosphide A, SPB, SPC, and sulfur monophosphide D all play crucial roles, with sulfur monophosphide B and sulfur monophosphide C being especially critical for reducing surface tension. Which condition frequently coexists with RDS? A. Patent ductus arteriosus, PDA, B. Coarctation of aorta, C. Tetralogy of Fallot, or D. Transposition of great arteries. The correct answer is A. Hypoxia and lung disease from RDS keep the pulmonary vascular resistance high, maintaining the patency of the ductus arteriosus, leading to PDA. Which of these factors is a risk factor for developing RDS? A. Post-term birth, B. Prematurity, C. Intrauterine growth restriction, or D. Breech presentation. The correct answer is B. Prematurity is the primary risk factor, as lung development and surfactant production are completed late in gestation. What is a nursing priority for an infant on a radiant warmer? A. Monitor blood sugar. B. Monitor insensible water loss. C. Assess airway. Or D. All of the above. The correct answer is D. Radiant warmers increase insensible water loss, alter glucose metabolism, and can impact airway stability. Monitoring all three factors is essential. Lecithin/sphingomyelin L4S ratio in amniotic fluid suggests lung maturity at A. 1:1, B. 2:1, C. 0.51, or D. 3:1. The correct answer is B. An L/S ratio of 2:1 or greater in amniotic fluid is a traditional marker of fetal lung maturity. What is the most common cause of neonatal mortality? Is it respiratory distress, sepsis, congenital anomalies, or birth asphyxia? The correct answer is A. Respiratory distress, including RDS and pneumonia, is a leading cause of neonatal morbidity and mortality, particularly in premature neonates. What does BPD mean in neonates who had RDS? Is it bronchopulmonary dysplasia, bronchial pressure disease, bilateral pulmonary distress, or bacterial pulmonary disease? The correct answer is A. Bronchopulmonary dysplasia, or BPD, is a chronic lung disease resulting from prolonged oxygen therapy and mechanical ventilation in infants treated for RDS. What is the purpose of prophylactic surfactant administration? Is it to treat established RDS, prevent RDS in high-risk preterm infants, reduce lung fluid, or stop heart failure? The correct answer is B. Prophylactic surfactant is administered soon after birth to extremely preterm infants to prevent the development of RDS. Why does apnea occur in RDS patients? Is it due to an immature respiratory center, fatigue from work of breathing, hypoxia, or all of the above? The correct answer is D. RDS patients can suffer apnea due to immature brainstem function, exhaustion from intense respiratory effort, and hypoxemia depressing the respiratory drive. Which position is recommended for infants in respiratory distress? Is it prone, supine, Trendelenburg, or high Fowler's? The correct answer is A. Prone position can improve oxygenation in neonates with respiratory distress by improving ventilation perfusion matching if monitored. Which electrolyte imbalance can worsen apnea in neonates? Is it hyperkalemia, hypocalcemia, hyponatremia, or hypermagnesemia? The correct answer is B. Hypocalcemia is common in preterm and stressed infants and can contribute to irritability, apnea, and seizures, complicating RDS management. What is a goal for oxygen saturation in an RDS infant? Is it 80 to 85%, 90 to 95%, 98 to 100%, or 70 to 75%? The correct answer is B. Targeting 90 to 95% saturation prevents both hypoxia and hyperoxia, reducing the risk of retinopathy of prematurity.